Hello, everyone. My name is Mike Lamarca, and I'm going to be talking about kleptomania. We can start off by going over the diagnostic criteria. A would be a recurrent failure to resist impulses to steal objects that are not needed for personal use or for their monetary value. B is an increasing sense of tension immediately before committing the theft. C, pleasure, gratification, or relief at the time of committing the act. D is the stealing is not committed to express anger or vengeance and is not in response to delusion or hallucination that can be seen in disorders such as schizophrenia. And E is the stealing is not better explained by conduct disorder, manic episode, or antisocial personality disorder. So I'm going to expand on that last point in the next slide. Um, Conduct disorder was mentioned because one of the criteria for that is stealing an object from another without confronting them. But the difference between conduct disorder and kleptomania is the surrounding aspects of it. So in conduct disorder, you also need to be diagnosed with two other criterion, such as destructive behavior or cruelty. Manic episodes, some that when they experience that, they may engage in risky behaviors, and that can include thievery. Again, the surrounding behaviors can differentiate. And finally, antisocial personality disorder, which is it's really important to differentiate between this one and kleptomania. Again, it's the surrounding disorders. Antisocial, there's really no remorse, while in kleptomania there is for the stealing. So I'll talk about the development and the course of kleptomania now. It typically begins in adolescence, but it's been shown to begin as early as childhood, as late adulthood, and everything in between. Kleptomania typically follows three courses that have been described. One, it's been sporadic with brief episodes and long periods of remission. Two, episodic with protracted periods of stealing and periods of remission. And three, chronic with some degree of fluctuation. So this really ranges from the least severe being sporadic and the most severe being chronic. So next we can talk about risk and prognostic factors. There have not yet been any controlled family studies for kleptomania, so we're kind of limited in what we know about it. What we do know is that first degree relatives of individuals with kleptomania may have higher rates of OCD, and they'll also be a bit more vulnerable to substance use disorder, including alcohol use. Consequences of kleptomania. Obviously, there are legal consequences to thievery, thus making those with kleptomania more vulnerable to legal action. This disorder also causes career, family, and personal difficulties associated with the disorder. We can talk about prevalence rates now. Approximately 4 to 24% of those arrested for shoplifting are diagnosed with kleptomania. So that's actually a pretty inflated number when you really think about it. In the general population, only 0.3 to 0.6% of individuals have been diagnosed with this disorder. And a bit of a cultural aspect is females outnumber males at a 3 to 1 ratio for kleptomania. So females are more likely to be kleptomanics. A little bit about the history of kleptomania. It was first described in the 18th century as a way to describe people who steal meaningless items, and it's progressed since then. In 1962, it was included in the DSM-1 as a supplementary term. It wasn't until the DSM-3 that kleptomania was added as a disorder of its own, so it was skipped in DSM-2. And it's currently classified as an impulse control disorder in the DSM-5. So next, we'll talk about the etiology of kleptomania. The exact cause of it's unknown, but there are three schools of thought in relation to the cause of this disorder. So one, we'll talk about psychoanalytic. Two, cognitive behavioral, and then finally biological. Psychoanalytically, it was started by Sigmund Freud, and he suggested that kleptomania resulted from repressed sexual urges. Seemed to be his go-to. Um, More current psychoanalysts suggest that kleptomanics steal to replace an actual or anticipated loss. We'll talk about cognitive behavioral now. These theorists believe that stealing may be a result of operant conditioning, poor coping mechanisms, and distorted cognitions. So I'll go through each one of these. Operant conditioning could be a lack of negative consequences, such as getting caught, combined with positive outcome, they get a new item, and it feels good to suppress the urge, and it may encourage the negative behavior. Poor coping mechanisms, these individuals with kleptomania may be stealing to cope with anxiety or stress. And finally, distorted cognitions. Individuals use these cognitions to mitigate their guilt or convince him or herself to follow through with the crime. So, a couple examples of this final one. If they could tell themselves that their family deserves nicer things, so they'll take it from the stores, or they might convince themselves by saying that they're just sticking it to a big corporation. The little guy's winning one. And finally, we'll talk about the biological aspect. Biological theorists believe there's a neurochemical cause of kleptomania. So, low levels of serotonin, which help regulate impulse control, could be a link to the disorder. The release of dopamine, which causes pleasurable feelings at the time of committing theft, could encourage this negative behavior as well. And finally, an imbalance in the brain's opioid system, which regulates urges, may also cause these kleptomanic symptoms. As far as assessment goes, the Kleptomania Symptom Assessment Scale, the CASE, is used to assess the severity of an individual's kleptomanic symptoms. The scale uses 12 questions. They're mostly ordinal, and it assesses how often an individual steals, how often they're able to suppress their urges, and the emotional distress that they may feel as a result of the theft during and before. All right, next we'll go over the differential diagnoses that might be identified when trying to diagnose kleptomania. So, really, the big one is antisocial personality disorder. We've kind of gone over this. But this one includes a disregard for the rights of others, which can extend to the failure to respect lawful behavior. Kleptomania and antisocial personality disorder differ in that the former typically includes a level of remorse for the thievery, while the latter does not. Next, conduct disorder. One of the criterion for this disorder centers around theft. That being said, this disorder also requires the presence of two other negative behaviors, including, not limited to, cruelty to animals, destruction of property. And finally, a manic episode. Kleptomania should be distinguished from risky behaviors, which may include thievery, and really it's the surrounding behaviors that will really help differentiate. Next, we'll talk about comorbidity of other disorders with kleptomania. So, it's particularly comorbid with major depressive disorder. There's a pretty inflated number of those with kleptomania and those with major depressive. The disorder is also comorbid with anxiety disorder, eating disorders such as bulimia nervosa, substance use disorders, and other impulsive control disorders and cognitive disorders. So, as I mentioned, there's really no known cause for kleptomania, and that kind of makes treatment difficult. So, a lot of the treatment centers around treating the comorbid aspects of it. So, selective serotonin reuptake inhibitors such as Prozac have been shown to help, and opioid receptor antagonists have also been shown to help control an individual's urges, and it's been useful for kleptomania. Cognitive behavioral therapy is another treatment that has had success. This method identifies any distortions in cognition and works to rectify them. Some examples of this include aversion therapy, which the individual would practice mildly painful techniques such as holding their breath when they get the urge to steal, and also covert sensitization, in which the individual would picture themselves stealing and then facing negative consequences such as being caught. And these therapy sessions can either be done in a group or individually. So, next we can talk about the case presentation. So, Dana, a 30-year-old divorced woman who had various manual jobs, started shoplifting from the age of 23. She had multiple convictions of theft and several remand admissions. She was diagnosed with recurrent depression. She reported acts of stealing both during and outside of her depressive episodes. The acts of stealing were typically due to failure to resist the temptation and strong urge to take the items without paying and feeling satisfied after taking them. The items typically were of no use to her. She stated that the acts of shoplifting helped to lift her mood temporarily during the depressive episodes. She would later feel guilty, which subsided when she either threw away or gave the items to others. Regarding her shoplifting behaviors when she was not suffering from depressive episodes, she stated she could recognize that her mood would be marginally low during those times, but she was still able to function normally. So, reading this, I think right off the bat, we can eliminate any manic episode that she be going through because she seems to be struggling with depressive episodes. So, really, the big one I want to talk about is antisocial personality disorder. So, she is stealing, she is disregarding lawful action, but the main difference I've mentioned before between antisocial personality disorder and kleptomania, it's the level of remorse. In antisocial personality disorder, there is none, and Dana does seem to be remorseful for her actions. She just has the urges, and they go away when she does steal. So we can eliminate antisocial because of that. Also because there's really no mention made of any other antisocial behaviors. So kleptomania is the diagnosis we can make for Dana. So that's the end. Thanks for watching, everyone. And on the handout, I'm gonna be including the KSAS, so y'all can check that out. It's pretty interesting. Again, thanks for watching.